Well, in this week's Cardiology Countdown, we have two challenges to what would seem to be logical in the space of PFO and stress testing. And then we have an interesting survey of the management of patients with diabetes across different types of goals. So to begin with, we have a look at over 1,000 patients with patent foramen ovales seen on TE echo, followed for 11 years in a huge cohort with this long-term follow-up. It was 1,100 patients, a community-based analysis. And interestingly, they found no difference in the risk of stroke in those who had a PFO versus not. And they analyzed it with multivariable adjustment. And so I think a little bit of a challenge to see if you identify a PFO, what exactly do you need to do about it. I think it's an evolving area with new approaches that are there, but one that we'll have to really look carefully at how to best manage these patients. Next up, we have another challenge to conventional wisdom that looked at stress testing. This was a sub-analysis of the STITCH trial that looked at CABG versus medical therapy in patients with multivessel disease and LV dysfunction, so the highest risk group, where it was hypothesized that patients with ischemia on stress testing would be higher risk in terms of longer-term mortality and cardiovascular death and need for rehospitalization. This sub-study looked at about 400 patients, half of whom had been randomized to CABG, half to medical therapy. And a little bit surprisingly, there was no difference at all in mortality or cardiovascular death in those who did or didn't have ischemia, and that was true when controlling for other variables. They also found no interaction with CABG and medical therapy, so this was true in either group. And so a bit of a challenge. I think we nonetheless look for ischemia, but they note in this paper that the decision for revascularization has to be based on a complete clinical picture. And our number one pick is a look in the New England Journal at the management of diabetes, but across all the various goals that we seek for managing patients with diabetes. Now, this was a survey from the NHANES that looked at a 10-year period roughly from just before 2000 to 2010 to see at the relative change in glycemic control, blood pressure control, and lipid management. They saw a modest 8% improvement in the percentage of people who had a hemoglobin A1C less than 7, the current target goal. Next, they saw a 12% improvement in reaching the blood pressure goal of less than 130/80, but a 21% improvement in reaching an LDL less than 100. So nice trends, although they point out that between a third and nearly half of patients don't meet individual goals in an absolute term, and only 14% met all three of those seemingly obvious goals to try and reach. And so it shows some progress, but still a big unmet need in the overall management of patients with diabetes that hopefully we can improve their outcomes. So for this week's Cardiology Countdown, I'm Chris Cannon.